Hi, this is Dr. Cash at Dr. Cash Medical and Life. So the other day I saw a pretty interesting patient who presented to the hospital. And originally the patient went to see his primary care doctor in the office. And he was standing near the counter and complaining that he has been having trouble with having weakness where his legs just crumble and he would just stumble around. He couldn't use his fingers because they just don't work. And he was talking funny and slur in his speech. And so suddenly he just collapsed onto the floor, and then paramedics were called. And he was brought to the hospital and evaluated. He underwent multiple imaging studies, including carotid Doppler, echocardiogram, CT scan, and MRI of the brain, C-spine, T-spine, L-spine. So a fairly complete evaluation, and pretty much most of his lab tests were normal. And so after all the lab tests and imaging studies were done, neurologic consultation was obtained, evaluated, and we all concluded that we could not find a medical explanation for his deficits. And we came with the conclusion that he likely suffered from a condition which we call conversion disorder, of which a psychiatric disorder manifests itself into physical debility, and they would have these somatic type of symptoms where they would not be able to speak or to walk or to use their hands. And for him, the symptoms are real, as opposed to something like someone who is malingering, who is faking, who intentionally in their mind is faking. Then that would be different. But convergent disorder, in these patients, the patient believe deep inside that what they are suffering is something real. And so for this patient, he would go into these anxiety episodes where he gets super anxious, tachycardic, and start crying and yelling and cursing everyone, saying that no one cares and he's suffering, he's dying, he can't move. And so after he was reassured that everything will be okay, given that his evaluation has been negative for any acute process to explain his neurologic condition, he was discharged, and he refused to go initially. And then finally we had to call security that everything that we have done so far has looked good. And then he just got extremely mad at us and jumped out of bed and just dressed himself up and walked out yelling at everybody, as opposed to the last 3 days in the hospital. He was not able to, on command, move his hand, his legs, his feet, and he actually had a Foley catheter in because he couldn't get up to pee. He couldn't feed himself. Someone had to feed him. And so finally, when we confronted him and reassured him, confronted him, and if he wasn't going to leave, we will have to call security to escort him out. He just jumped out of bed and dressed himself up and left. And so for him, I do believe that his condition is convergent disorder rather than malingering, which is a psychiatric, psychological manifestations of other things in his life that may be happening, and that is why he felt the way he did. These people do have fairly fair prognosis of recovery, assuming they have hope in seeing counseling, psychiatry, and eventually maybe some medication that may help him as well. But overall, it was an interesting case in that initially we were concerned about stroke, about tumor, about myasthenia gravis, about many other conditions, but at least at the end, everything checked out okay, and he was able to get up out of bed and just left the hospital intact neurologically. So that was definitely good news for him as well. A lot of us were certainly relieved that we didn't find anything horrible, anything bad, and I hope that he'll continue to seek help with mental health and recover and move on with life. All right, so thank you for joining today. Convergent disorder.